Okay.
How do you do with your upper denture?
Well, I have to wear a lot of fixing in.
When we look at you in this area where we want to put this lap implant, this is the edge of your bone. And so it's shaped a little bit like a blade of a knife. There's no width, no bone really whatsoever there. And you used to have that width before your teeth were extracted years ago, and you went for years and years without teeth when you had that bridge that went from your eye tooth to your eye tooth. Before all of that, this bone was started right here and came straight down, and you had a lot of it. But over time, it atrophies. Bone's a little bit like a muscle. If you don't use it, then it kind of withers up.
Okay, I was in a car wreck about 28 years ago. A log truck hit me head on, and it broke my bones, my top bone and my bottom bone, and it knocked my front teeth out. I went through a year of being wired, eating through a straw. One day I was eating an apple, and I took a bite of the apple, and my teeth came out in the apple. So at that point, we went back, and they did permanent bridges where they built me some teeth, and they hooked them to the eye teeth. And I've been through probably 5, 6, maybe more of those. 3 years ago, we decided that we needed to do something better because it was expensive. Every time I'd do a bridge, it was $4,000 for a bridge, and we wanted something that that would be more permanent, that we wouldn't have to replace. So we started looking into doing implants, and we asked around, and all my friends had went to a doctor, and we went to the doctor, and we started the process of getting implants done. He pulled my back teeth, and he pulled all of my top teeth, put a denture in, and actually we were waiting for that healing so he could start. He was going to put 4 implants in the top, and at that time my daughter was diagnosed with cancer.
Saw a moment ago on our patient to the ridge on this patient. The patient a moment ago, the ridge was started out about this wide and came down the full length, staying this wide, all the way to here. You can see that they've lost it. This would be the lip out here. They've lost it from the outside in until the point where there's almost nothing left. The consequences of this are significant. One is that there's no support for the lip, so the face shrinks in. If we look in the back area of the same patient's mouth, this would be back about, maybe next to the last tooth in our mouth. If we look in that area, we can see that there's absolutely no ridge at all remaining. This is just a sinus, and the bone is just a slight remnant that we can barely see if we look here, but the bone for all practical purposes is completely gone. And so this patient both has lost their opportunity for placing an implant here without doing bone grafting into the sinus, and they've lost their ability to have any reasonable amount of support for their denture. Or support for their face. So the face wants to shrink in tremendously, giving us that very old, kind of wrinkled, squeezed in looking face. Now of course in dentistry we compensate for this by either wearing false teeth and building the plastic out to rebuild these ridges and then putting teeth on that, or in implant dentistry we regenerate bone and then place implants. But either way, and this long-term loss of teeth that have not been readily replaced has caused us to have all of this loss of bone and all these complicating factors to try to bring this patient back to a more normal appearance and contour to the face. That could have all been avoided by early intervention, by the replacement of these missing teeth within a few months to a year or so.